Welcome to our inaugural focus group and for the ACA workshop for this fall. And what we're going to do is really try to eliminate the confusion surrounding the ACA. So congratulations for being here. I look forward to working with you in the future. Jim Rousey is a great friend of mine. He's an ophthalmologist and a super man of faith. And he taught me three things that are really important, and I'm going to relate it to the ACA. It's the pearl, the practical, and the principle. The pearl is, for ACA, is that this ain't your father's health insurance. The practical is that when I was born in 1966, and I'm very fortunate that my mother's here today, my dad didn't do anything. He never had to pay a deductible. He went in 1966, presented the insurance card, and that was it. Well, today that's drastically different, isn't it? And what we're doing in the principle is to embrace. Don't shun or don't be mad about the fact that ACA is the law of the land, because when the principle here is when you change the way you look at things, the things you look at change. So for ACA, and why I'm very grateful to have a group of experts surrounding me, and you're going to meet them later today. So today we have an objective overview of your rights and options as it relates to Obamacare. Why this workshop? I don't know if you knew this, but 50 million Americans today are without health insurance. And one of the reasons for that is that it's cost prohibitive, right? They can't afford it, true? What's another reason that they don't have health insurance? Because they don't understand it, and a confused mind does nothing. So what we're going to do today is, Simon Sinek taught me something called the golden circle, and that we make our decisions emotionally, and we justify them logically. So I wrote a golden circle inspired by Simon Sinek around these workshops. And we believe that all Americans should possess a clear understanding of the ACA or Obamacare and the impact it has on their family or their business. Our vision is that everyone would have easy access to the tools and information requisite to make the right decision for their health coverage. The way we grant this access is through free, objective workshops given by experts that remove the confusion surrounding the ACA as it relates to their health insurance, their financial responsibility, as well as their tax implications. We just so happen to create confident, well-informed consumers that possess a firm grasp of their options and enable them to make a decision and move forward with a plan that will protect their family, their business, as well as their employees. The reason that anyone has insurance of any kind is to protect something, true? So that's another reason that we have people in long-term care. We have people that have asset protection, Medicare, MedSups. You're going to meet them in the future here in a little bit. So that's why. Would you like to become one? Is the one that I really know that there's a lot of people that say, yes, I would like that, sign me up for that. The team of experts, my name again is James Eric Ross. My father was in health insurance and actually life insurance, and I got my insurance license when I was 18, 48 years young. So I have 30 years of progressive experience, not only consulting with small businesses, but have a complete understanding, and I've seen that change in the landscape as it relates to health insurance. I'm also grateful to have Scott Lazzara, who is a tremendously impactful person as it relates to small business as well. He owns a payroll company, but he's also, and why he's here, is his expertise in the ACA, and that he can provide information and as it relates to anything regarding that. So Scott, thank you for being here. Brett Fuller, who is kind of my right-hand man for these the overviews here, and he has asset protection specialists as it relates to annuities and how to protect that, as well as Medicare and Medicare supplements. Thanks for being here, Brett. Matt Williams, who is becoming a good friend of mine, and his father, Larry, has a very powerful network that you're going to learn more about, because we have to understand that as the landscape changes, we have to adapt to that. So they own imaging organization in St. Petersburg and 3 other locations in Ocala, and he's the founder of the Affordable Healthcare Network. Matt, thank you for being here. And Bob Franke, another not only a business colleague but a friend. And Bob is a long-term care specialist as well as a life insurance specialist. So thank you, Bob, for being here. The genesis of ACA. Now, this is just a long-winded thing, but basically the reason why ACA came into effect is because there were a lot of people that could not get coverage, and the government stepped in to enable those people that weren't insurable because of underwriting to get coverage. And it provides subsidies for those moderate income families as far as small businesses with by taxing some healthcare providers and high income families. So what's absolutely changing is right here. The whole landscape is changing from a fee for service basis to quality for care basis. And the overall goal of ACA is to lower the healthcare costs. And again, we're being objective. This is nothing political about this. I'm going to talk about the pros. What are the good things about the ACA? Well, the Act was designed to reduce the healthcare costs, and by making services available to those that can't get insurance. And that is, emergent care, maternity, mental health, and that actually started in 2014. Another pro to the ACA is it requires that all plans cover the 10 essential health benefits. And EHB is part of that, and we do have, because of time constraints, all of you will get a thumb drive with all of this information on it so that you will understand what those 10 essential health benefits are. And the goal of what we're doing is that you would have a better understanding, come away with a more clear picture of what's going on, but you'd be able to lean on our expertise going forward. Another pro is for people that can't afford it, and there's a lot. I found out that there's a statistic that 50% of Americans are on some type of government subsidy, and ACA would be part of that. The federal government will pay the state to add them to Medicaid for people that can't afford it, and it's expanded up to 133% of the federal poverty level. The cons to ACA or Obamacare. Between 3 to 5 million people could lose their company-sponsored health care plans, and that's already happening, as some of us have seen, where they're just canceling the plan. And some small business owners, and that is our primary focus, business owners of 50 employees or less, they have to find a more cost-effective way to pay the penalty and let their employees purchase their own insurance plan, not only through the exchanges, but non-qualified plans, and that's why we created these workshops. Increased coverage may actually raise overall healthcare costs in the short term, and we're seeing that now. We were just having a conversation, Scott and I, about Blue Cross had a increase. They got approved for that increase. Can you talk a little bit about that? What's happened over the last 2 years, Scott?
Yeah, I mean, exactly to your point. Most of the people that signed up for coverage last year were people that were not healthy, that were sick. They needed coverage. They weren't able to get coverage before. So they're high utilizers of the health insurance plans, and Blue felt it. Blue signed up more than anybody else in the state of Florida, and they got most of the sick people as well. So that's reflected in the renewal rates, which are going to be around 18% higher this year.
So think about that. When you have, as a small business owner, and I am a small business owner, and the room's filled with small business owners, we want to have predictable fixed costs. We don't like the roller coaster ride. So another con to the ACA is that the individual mandate says that you have to obtain the coverage by January 2014, which was last year, but you get an exemption. Now we're coming into the next open enrollment November of 2014 through February of 2015. Insurance companies, they have to cover the sick people, and obviously, to Scott's point, if you flood the market with people that are utilizing it constantly as opposed to the people like me, then you're going to see those burdens of increase. There's no other way around it. We're going to go through some frequently asked questions, and I want you to think about these as we're walking through them. And if you look at one of the first ones, and these are just 10 questions that we've come up with that we hear in the field. And should I go without coverage and take the penalty? Well, that's on a case-by-case basis, because I would much rather us go to Las Vegas and put it all on black than not have health coverage, especially if you have something to protect. So again, that's we would have to sit down with you and look at what it is that you're trying to accomplish. The penalty, how it's imposed, and one of the things that a lot of people are confused about is this. And I've seen that it's $95 for the year. I've seen it's 1% of your gross. So again, one of the things that we have here are tax experts. So when we ask these questions, we want to be able to point you in the right direction so that you can get the information based upon your income, and that's different for everyone. We're going to just go through these really quick, but the reason why I want you to see these is because we have all the answers to all these. What's the difference between an ACA plan level? Scott, can you speak a little bit about just the different things between, say, the bronze and the platinum, the polar opposites?
Well, they've categorized all health insurance plans to what they call a metallic level. And all that really means is that a platinum plan, it's going to be 90% coverage. In other words, your cost is going to be about 10% of covered services. Gold is 80, silver would be 70, and then bronze would be 60.
And on a family of four, just a typical family of four, on a platinum plan, what prices have you seen with Blue Cross Blue Shield for a family of four small business owners?
Well, it's a good example. I'm a family of four, and platinum plan for us would be about $1,800 a month.
Okay. Which there are people that can afford that, $1,800 a month, without a subsidy, correct?
That's raw premium.
Raw premium. And the deductible on that plan is how much?
It can range depending, but usually it's anywhere between $0 and $1,000 per person for a platinum plan. All co-pay driven for every service.
Okay. And again, these plans are right for some people, and for some people they're not. That's the whole reason that we're having these workshops. Another great question is, how do I qualify for a subsidy? And we actually have the paperwork that shows the age and how much you make and what you qualify for, and we want to be facilitative in helping you understand if you do want to do that and why you should. What insurance carriers participate in the ACA? There's three big ones, Scott, and I know we've already talked about this. Blue Cross by far is the largest. Then you have Aetna, and then followed by Aetna's Humana. And then you kind of have the also-rans. You know, you have Win Play Show, right? And in the horse racing, you have also-rans. And those are Assurant and so forth, some smaller carriers. But the majority of those three carriers make up a large percentage of that pie. I believe around 10 million people have signed up on the exchange right now.
Signed up, but stuck with it is another story.
Okay.
That'll be the next news thing you hear. Yeah.
Okay, so we'll go into that. Some more FAQs is the premium guaranteed for a specific time period. With ACA, a compliant plan, no, it's not. They can raise it typically when you get it, and Scott and I talked about this, it's usually 12 months that you have that, but there's no real guarantee.
It's my understanding that all plans renew on January 1, so if you buy one today, it's going to renew in 4 months.
Okay. So if you
buy a higher rate.
With a higher rate, 18% increase. What's the cancellation policy for my plan? I do sell a plan that is a non-compliant or not qualified plan, so I can speak to mine. There is no, I mean, it's month to month, and with ACA, there's no contract.
You can cancel as well at any time, obviously, if you pick up other coverage through an employer. But if you do cancel and don't get a qualified plan, to be subject to the tax penalty shared responsibility payment.
This is an interesting one, and I don't know if you've heard the term cardectomy. What a cardectomy is you're unconscious and you're in an ambulance. They have instructed, these are private hospitals, have instructed the ambulance drivers and EMTs to look for your insurance card. And unfortunately, this isn't 100%, but I know for a fact that a lot of doctors, and Matt Williams is here from the Affordable Healthcare Network, and their vendors, they're not getting paid by the ACA. There's a slow pay. So a lot of that is coming to light right now, and this is early, but we're going to see more and more of will the doctors accept it? Because doctors are for-profit entities. What alternatives do I have to ACA? And we're going to go through that. It's right here. So you have alternatives are do nothing. Well, that's simple, and I don't recommend that, especially if you have something to protect. The second one would be a fixed benefit or indemnity plan, and the word indemnify means to make whole, to give back to make that person wherever they were. What is it? It offers benefits for specified procedures. There's a national average for any medical procedure that you can think of that has a limit or a cap to it. It's $1 million cap per person per lifetime. A fixed indemnity plan offers first dollar coverage, so there isn't any deductibles. There are no co-payments. Benefits are paid directly to the doctor provider at the insured's option, and they also have, if there's an overpayment, meaning that there was $25,000 in charges and the indemnity plan paid $30,000 of the 25, that $5,000 goes to the patient, that overpay. The third one would be discounted plans or associations like AARP. The barrier to entry for some of these large associations is there is no barrier to entry. And typically, they are inexpensive, but they're not insurance. So we don't recommend those unless you couple that with something else. Let's talk a little bit about the fixed indemnity product. Many Americans have decided to opt out of the ACA. And the reason being is because either they don't agree with it and they're willing to take the $95 penalty for sidestepping the individual mandate. For many Americans, opting out of the ACA is the best decision they can make because, and this is a quote from Susan Breitbart, and this is her blog that she does every week, and talks about some different things that you can look at as opposed to the ACA. People who want to opt out, they should be looking at alternatives like what we talked about, a fixed indemnity plan. I was in the military for 8 years, and our slogan in the Army was improvise, adapt, and overcome. Because where there is adversity, I don't look at the adversity or the challenge, I look for opportunities not only to help people, which we are, but to give them the necessary information to make the right decision for their family. Alternative insurance plans like fixed benefit critical illness or accident insurance plans have a place. And healthy Americans, and I'm talking about people like myself, I don't take any daily medications. The last time I was in the hospital, Nixon was in office, and I rarely get sick. The last time I was sick was 3 years ago. So when I was given the opportunity to look at an ACA plan or a limited benefit plan, it made sense for me to do this. Now, it doesn't make sense for everyone, but this is